I just did a nerve test on someone, and she has a pinched nerve in her neck, cervical radiculopathy. She had a nerve test done by a different neurologist in April of 2024. So a year and a half ago, she had a nerve test done. And he found that she had a cervical radiculopathy, a pinched nerve in the neck. He found the same thing I found. So he made a referral for her to see one of the neurosurgery people who had previously operated on her neck at a different level. And she had a telehealth appointment with the PA from neurosurgery. And the PA referred her to the pain management doctor on a telehealth visit, and the pain management doctor gave her an ablation for pain from the pinched nerve. So she comes to see me today because she developed a trigger finger. So she had trigger finger and went to see the hand surgeon, and the hand surgeon said, wait a minute, you have a lot of weakness in your hand. You need a nerve test because you can't use your hand properly. So I did a nerve test, and she has a pinched nerve in her neck, and she has weakness in C8. And her hand is not completely useless at this point yet, but she's lost a lot of motor function. I'm not a neurosurgeon, but when you evaluate someone neurosurgically, there are two indications for surgical intervention. There's two reasons why you may need to do surgery. One of them is intractable pain, and the other one is progressive neurological deficits. If you have a patient who is losing motor function over time and they're getting progressively worse, that's one reason, regardless of the pain level, why you may want to consider an intervention. And I'm not saying you need to do one. There's risk-benefit analysis still done, and you still have to consider whether or not the procedure makes sense for this particular patient, but it's an important, and I think many of us feel more important reason to consider it than, the pain, because intractable pain, it's kind of a subjective issue. When a neurologist referred this patient to a neurosurgeon, she wasn't examined for evidence of weakness. She was just sent to pain management to see if that would fix the pain. And actually, she wasn't seen by the neurosurgeon, and she actually wasn't seen by the PA. And you can't examine somebody for weakness on a telehealth visit, so I'm not happy.